Welcome to Positive Recovery MD. If you're listening, chances are you want to create happiness around you and thrive in your life. We're glad you're here and you've come to the right place. This podcast will inspire and motivate you to not merely survive your recovery journey. We'll give you the tools to build or strengthen your foundation to thrive and flourish in your life. In each episode, we will come together as a community to have authentic conversations around addiction, recovery, and what matters, growth and progress, not perfection, all while developing positive habits for you to utilize. To learn more, please visit positiverecovery.com/podcasts to sign up and to receive the daily positive interventions that we'll review, as well as gain access to exclusive Positive Recovery content available only to Positive Recovery MD listeners. All right, let's get started.
Hello, everybody, and welcome again to Positive Recovery MD podcast. I'm your host, Dr. Jason Powers. In this podcast, we talk about anything that can help you flourish as it relates to life in general, as it relates to flourishing and recovery. And today, I'll be doing a solo episode, and I'll be answering a few questions. So, what role does mental health play in recovery, and how can we combat the stigma behind mental illness? So, mental health plays a significant role in recovery. It plays a significant role in life. And although there's been a lot of awareness and education in mental health, especially somebody like me who's longer in the tooth that can remember growing up and there was zero awareness, zero education, it seems like. Anyway, looking back, but in my younger years, there was certainly not the amount of coverage in the media that we get today, in terms of, it was unheard of for athletes or, corporate leaders or politicians to disclose that they were struggling with anything. It's sort of, don't ask, don't tell type of unwritten policy. So although there's a whole lot more awareness and education today, there is still a ton of stigma. And, I've said this before, but, nobody really wants to be diagnosed with addiction. And it seems like those that I treat really don't want to be diagnosed with anything else, especially, bipolar. For some reason, that still gets a ton of negative connotations. And the sad thing is that probably 80% of people that seek treatment for addiction or substance use disorder, that's what it's officially called, have a comorbid illness or a co-occurring thing that's in the, mental health arena, like anxiety, depression, post-traumatic stress disorder, bipolar, and the like. So because of that, we've kind of developed this mantra that if you're not treating both things, if you're not treating addiction and a mental illness, you're not treating either. Because, for example, if you get treated for your addiction, but you have untreated depression, then you're not treating either. Chances are you're going to be self-medicating at some point that mental illness with things that you've got to stay away from in order to stay in recovery, and vice versa, right? If you sort of get on an antidepressant but aren't treating addiction, forget about it, like for many reasons. First of all, a lot of medications, I'd say the majority of them that we use in the psychiatric world, sort of don't get a chance to work if people are putting mind-altering substances in their body, and often it can make things worse. So, being on an antidepressant, for example, and drinking a lot tends to, in my experience, not only not help the depression, but can make things worse. And a lot of people don't tell their prescribing doctor the truth about how much they're drinking or if they're using other drugs. And so, they'll be on medications that interact negatively with whatever substance you're putting in your body, whether it's marijuana, alcohol, or whatever. So, back to the mental health plays a significant role in recovery. And, just realize that at the end of the day, nobody is normal, right? Normal is a setting on a washing machine. I've never met a normal person in my life, which is, I think, a good thing. It makes us interesting how sort of nuanced we are, but everybody everybody struggles. The human mind is just kind of a disaster area, right? We're the only ones aware of this running dialogue that's going on in our head. And, some people ruminate, some people criticize themselves, some people are judge, others and themselves. And the mind is a racing, craving thing. In fact, there's a great saying that the person who controls their mind is more powerful than the person who conquers the entire world with an army. Because that can be a struggle for a ton of people. So be gentle with yourself, accept your humanity, and seek help. Next question: in what ways can mindfulness and meditation practices aid in managing mental health during recovery? Wonderful question. So mindfulness and meditation practices are probably the best things you can do for your mental health and for your brain health in terms of, staving off cognitive decline. We used to think that people who were diagnosed with, I know this is a tangent, but we used to take people who were diagnosed with Alzheimer's and teach them a new language or Sudoku. And after years and years, we've figured out that we just had people with just as advanced Alzheimer's of those who we didn't, expose to a different language in Sudoku. But now we had people who were doing Sudoku in French. And I'm joking, but, the best thing for your brain health in terms of preventing Alzheimer's, and if you have been diagnosed with it, slowing its progression, is meditation. Meditation increases blood flow to the brain. So, brings in a lot of healthy oxygen and nutrients. And because of the blood flow, it removes, waste and things that might build up in the brain. We know keeping your blood sugar under control is amazing for the brain. Mindfulness is sort of an awareness in a moment to moment, in a non-judgmental way. And it helps back to the fact that, the mind is a mess. And anything we can do to sort of create order in it is very helpful. Meditation and mindfulness are things to practice when all is calm and well. It is during the easy times that we can build up this strength that can be applied when stressed, when things happen. Because in the middle of a panic attack, that's absolutely not the time to start practicing mindfulness or meditate. And in terms of recovery, people that come into treatment don't do so on a winning streak. So there's lots of wreckage in terms of negative consequences, but there's also this lack of coping skills, right? Because, drugs, including alcohol, and process addictions like gambling and, sexual acting out, other codependencies, or, food, using food as a coping skill. When these are removed, then the person is sort of naked, right? It's like getting pushed out of an airplane at 20,000 feet, and the parachute that you've used to, sort of manage emotions is gone. So you're falling down towards the ground in a freak out situation. Thing is, if you choose to use that same old parachute, if you relapse, then you're going to have to start over at some point, because the things that you're avoiding dealing with, the hardships of life and the sort of emotional turmoil that goes along with, being faced with uncertainty, being faced with fear, being faced with the unknown, loss of relationships, loss of people, loss of financial security is tough. And, those of us who made a habit of, drinking, drugging, and using other processes can be sort of left out there to the wind, but nobody hits the ground. People in my experience, which is over 20 years now of having this disease and treating it, nobody splats. That is, as long as you do not use no matter what, you do not act out no matter what, you're going to develop coping skills. The best ingredient for developing those coping skills is not using, not acting out. And mindfulness and meditative practices allow you to sort of observe the mess of the mind and see the patterns that the mind will go to when pushed, right? We generally go to the same few neighborhoods. And what I mean by that is that, when you meditate, you kind of observe your thoughts in a non-judgmental way. You don't try to change anything. Mindfulness is the same thing. It's a form of meditative practice. It's just, again, bringing non-judgmental awareness to what's going on. And instead of being beholden or being led by certain thoughts, you're able to observe them, watch them come and go. And in that way, you can respond to life rather than react to life. You also are able to, this is particularly important for people who have addiction and want to be in recovery, is that there's going to be cravings, and cravings is a thought. Craving is a thought. It's an urge, right? The desire to habitually participate in rituals that we've been doing for a long time is also a thought. And being able to observe it and watch it come and go is very important. And I don't mean to suggest that all you have to do is like say Om and like watch things, because one of the best things you can do for cravings is also a healthy distraction. Do something else. Get your attention on something else. Our attention is a limited sort of bandwidth of being able to hold about 8 bits of information. Most people have 7 plus or minus 2 bits of information in their attention. And if your attention is, it's going to be filled with thoughts that come and go. And if one of the thoughts is cravings or despair, and you focus on it, and you focus on what's wrong, or you focus on that craving, then it can be overwhelming. But learning to observe your thoughts and shift gears, sometimes it doesn't go as quickly. And so you've got to think happy thoughts. You've got to engage in another activity. For people early in recovery that find it very difficult to meditate by, sitting and observing, man, there's other forms of meditative practices you can do that are healthy distractions. You can do walking meditation, yoga. Yoga is a form of sort of body movement that was designed to help these yogis that were sitting in this position and getting sore and everything. And it is a way of controlling your breathing and your body where your mind can follow, Now, what specific meditative practices that I follow that would be helpful for others? I mean, I think I talked about it. I did the mindfulness practice as sort of developed by Jon Kabat-Zinn. It's great because there's different techniques that you can use. His book is great. There are students of his that are sort of certified teachers that are around. I particularly loved hot yoga at first. Now I love doing the sauna. And in there, I think I did a podcast on this, so I'm not going to go into too much detail about it, and you can listen to a previous episode. But man, it's hot, and I'm pushed to an extreme, and I'm sort of forced to meditate or leave. I'm forced to bring non-judgmental awareness, and that has translated over to a lot of emotional resilience. Somebody new to recovery that's working on their mental health and in recovery, make sure that you've got professional help if you need it, and find something that you enjoy doing during the down and easy times. Because again, if, when the, what hits the fan, it's not a time to develop resources. It's sort of a time to like hold on. And during those times, surround yourself with somebody you trust or other people that you trust, and sort of get through it. And a lot of times when shame attack hits or something else, my mentor or a sponsor in this case would just say, man, that sucks. And I wanted him to like make it better or give me something else to do. But the truth is, like, sometimes in the meanwhile is just a mean while, and there's not a lot that can be done. And now we can worsify things. We can relapse, right? We can act out, but patience can be elusive. But you know what? If like every time that I have an opportunity to practice patience, I think, okay, this is really hard, and I don't want to like do nothing. I want to rage against the machine or whatever it might be. I think to myself, which I think is helpful, is sort of, this is a time I'm practicing patience, and I'm building that patience muscle for whatever it's worth. And going through enough hard times and struggles in recovery gives you the self-efficacy to realize like, oh, wow, I just did that. The first time people go through cravings and they don't use is invaluable, because now you intuitively know that you can get through it without using. And then the same translates to emotional resilience. That is like knowing that you've gone through hardships before is somewhat of a carrot that you can do it again. I mean, and that's sort of the basis of self-efficacy, is just knowing that you can amass the resources to get through what you're going to go through. And don't worry about the future, because whatever may come, whatever horrible thing you tell yourself is waiting for you, like those usually don't come true. And we all are going to face hardships in the future. And just realize the version of yourself that's going to be able to manage that is not in existence yet, hasn't been created. But just trust you'll get through this. This too shall pass. So hopefully this has been helpful. This is a great day. Sort of whip out the Positive Recovery Daily Guide. All right, this is really applicable. Good. And on day 364, page 369, the quote by Javi Galindo is, "Through practice, we can more deeply realize that happiness is not the result of what we bring into our life, but the consequence of how we choose to experience our life. Watch your thoughts, for they make your life. Developing self-awareness depends on thought recognition, which is one of the most powerful tools you can develop for optimal wellness. When you recognize that your thinking is creating your experiences, you become less attached to fixed thinking, and you gain control of your experience. You can either entertain thoughts of self-doubt, blame, and victimization, or you could choose more useful thoughts during the periods of relative peace to restore your equanimity when faced with challenges. You can't predict the future. So why focus your attention only on adverse prospects when neutral or even positive events are often more likely? Choose gratitude and optimism instead." So today's positive intervention is find your anchor in your breath for 5 minutes and sit in quiet meditation. Write down 3 good things that have happened to you so far today and explain why these good things happened. Then imagine all that could go right for you the rest of your day and tomorrow. Anticipate positive occurrences and become more aware of the precious possibilities that lie before you. So thanks for joining me today, and take care of yourself, take care of others. We are more similar than different. This is all we got. Until next time.
Thank you for listening to this episode of Positive Recovery MD. Don't forget to visit positiverecovery.com/podcast to sign up to get your daily positive interventions sent straight to your inbox. Be sure to subscribe to Positive Recovery MD on Apple Podcasts or wherever you listen to your podcasts to receive an automatic download when a new episode drops. And as always, if you or someone you know needs help, visit positiverecovery.com or call 877-4-SOBRIETY. That's 877-476-2743. Our why is simple. We care. We are here to help.